The COVID-19 pandemic brought the world to a standstill, leaving millions grappling with its aftermath. While most people recover from acute infection within a few weeks, a significant portion experiences lingering symptoms long after the initial infection subsides. This condition, known as long COVID, has emerged as a major public health concern, affecting people across age groups and health backgrounds. Long COVID, also known as post-acute sequelae of COVID-19, PASC, is characterized by a wide range of symptoms that persist or develop after the initial COVID-19 infection. These symptoms can be debilitating, affecting nearly every organ system in the body and significantly impacting quality of life. Common symptoms of long COVID include fatigue, brain fog, shortness of breath, chest pain, and joint pain, among others. The diversity and unpredictability of these symptoms make diagnosing and treating long COVID a complex challenge for healthcare professionals worldwide. As we continue to learn more about this multifaceted condition, understanding the underlying mechanisms of long COVID is crucial for developing effective treatments and improving the lives of those affected. Researchers are working tirelessly to understand what causes long COVID. One prominent theory suggests that the virus might linger in certain organs even after it's cleared from the respiratory system. This viral persistence hypothesis suggests that the SARS-CoV-2 virus, or remnants of its genetic material, may remain hidden in reservoirs within the body. These reservoirs could include tissues in the gut, heart, brain, and immune system. The presence of viral fragments in these organs could trigger an ongoing immune response, leading to inflammation and the wide range of symptoms associated with long COVID. Studies have found evidence of viral proteins in the blood and tissues of long COVID patients long after their initial infection. While further research is needed to confirm the role of viral persistence in long COVID, these findings provide valuable insights into the potential mechanisms driving this complex condition. Understanding the role of viral reservoirs could pave the way for targeted therapies aimed at eliminating persistent virus and reducing inflammation. With the urgency to address the growing burden of long COVID, scientists are actively investigating potential therapies. These treatments target different aspects of the condition, from managing symptoms to addressing potential underlying causes. One promising avenue of research focuses on antiviral drugs. These medications, originally developed to treat viral infections, are being tested for their ability to eliminate any persistent virus in the body. Immunomodulatory therapies are another area of active investigation. These treatments aim to regulate the immune system, which is believed to be dysregulated in long COVID, leading to chronic inflammation and tissue damage. Other experimental therapies include anti-inflammatory drugs, monoclonal antibodies, and plasma therapy. These treatments aim to reduce inflammation, block harmful immune responses, or provide antibodies from recovered COVID-19 patients. Vaccines have been instrumental in curbing the spread of COVID-19 and reducing the severity of acute illness. Now, researchers are examining whether vaccination can also play a role in preventing or treating long COVID. Studies have shown that vaccination against COVID-19, even after infection, can reduce the risk of developing long COVID. This suggests that vaccination may help prevent the long-term consequences of the virus, even in individuals who have already been infected. Moreover, some individuals with long COVID have reported experiencing improvements in their symptoms after receiving vaccination. This observation suggests that vaccination might help modulate the immune response and potentially alleviate some of the long-term effects of the virus. While vaccination offers a glimmer of hope in the fight against long COVID, more research is needed to fully understand its long-term impact on this complex condition. Section 5. Navigating public health challenges and future directions. Long COVID presents a significant public health challenge, with the potential to overwhelm healthcare systems and impact economies worldwide. The sheer number of individuals affected by long COVID, coupled with the complexity of the condition, requires a coordinated global effort to address its multifaceted implications. One of the primary challenges in addressing long COVID is the lack of a clear definition and diagnostic criteria. The wide range of symptoms and their subjective nature make it difficult to diagnose and track the condition accurately. Furthermore, the long-term consequences of long COVID are still unfolding. Understanding the potential economic impact of this condition, including lost productivity and healthcare costs, is crucial for developing effective public health policies and interventions. Section 6. The Quest for Answers. Ongoing research and its implications. Research efforts are ongoing to unravel the mysteries surrounding long COVID. Scientists are working tirelessly to identify biomarkers that can help diagnose the condition earlier and predict its course. Clinical trials are underway to evaluate the effectiveness of various treatments and management strategies. These trials aim to provide evidence-based recommendations for healthcare professionals caring for individuals with long COVID. Understanding the long-term effects of long COVID on different organ systems is crucial for developing targeted interventions and preventing further complications. Section 7. Living with long COVID. Support and management strategies. Living with long COVID can be challenging, but there are resources and support systems available to help individuals cope with the condition and improve their quality of life. Support groups and online communities provide a platform for individuals with long COVID to connect, share their experiences, and find emotional support. These platforms can also be valuable sources of information about managing symptoms and navigating the healthcare system. Lifestyle modifications, such as pacing activities, prioritizing sleep, and engaging in gentle exercise, can be helpful in managing fatigue and improving overall well-being. Working closely with healthcare providers to develop an individualized treatment plan is essential for addressing specific symptoms and managing any underlying conditions. Section 8. The Road to Recovery. A message of hope and resilience. While long COVID can be a long and arduous journey, it's important to remember that recovery is possible. Many individuals with long COVID experience gradual improvements in their symptoms over time. Focusing on self-care, adopting a positive mindset, and seeking support from loved ones can be invaluable during the recovery process. It's essential to celebrate small victories and acknowledge progress, no matter how incremental it may seem. Remember that every individual's experience with long COVID is unique, and there is no one-size-fits-all approach to recovery. Section 9. A Call to Action. Investing in research and patient care. Addressing the challenge of long COVID requires a collective effort from policymakers, healthcare providers, researchers, and the public. Increased funding for research is crucial to accelerate the development of diagnostic tools, effective treatments, and preventive strategies. Expanding access to specialized long COVID clinics and support services is essential to provide comprehensive care for those affected by the condition. Raising awareness about long COVID and reducing stigma is vital to ensure that individuals receive the support and understanding they need. By working together, we can mitigate the impact of long COVID and pave the way for a healthier future.